Is dissociative identity disorder caused by genetics or environmental factors? Psychologists have yet to completely understand the disorder because the symptoms are closely related to bipolar disorder and ADHD. DID is a form of dissociative disorder that occurs when a child or a person suffers from a traumatic experience that they cannot comprehend. According to Caroline Spring in a 2012 study, dissociative identity disorder does not happen in a vacuum. It does not result from the chemical imbalance in the brain, and it is not caused by faulty genes. This study explains that DID is not caused in the brain by one simple experience, but by repeated, painful memories that people cannot understand. Many doctors have yet to completely understand DID. However, they have found valuable information by studying the causes and the symptoms. Even though DID has not been fully developed, been fully understood, the causes of the disorder are quite clear in every patient, a traumatic experience that one cannot comprehend. Disassociation is a word similar to detachment. During or even after a traumatic experience, the sufferer will detach his or herself from their mind as an escape. While DID can occur in anyone, it is mostly developed during childhood. When a child suffers from a traumatic experience, such as sexual abuse, their underdeveloped brains do not understand what is happening. Adults are more likely to develop post-traumatic stress disorder because they can cope with their trauma and express their feelings. Children's painful memories of what they experienced can be suppressed or dissociated. Not only can trauma such as mental, physical, or sexual abuse be a cause for DID to develop, an unstable home life and environment can also be a cause. A child's home life greatly affects whether or not a dissociative disorder occurs. If a child does not have the words to discuss their experience, or if they feel that they have no one to tell, the memories and painful emotions can be dissociated. In some cases, dissociation occurs as a way to comprehend traumatic experience, but in other cases, it occurs as a way to forget the memories. DID consists of a variety of different symptoms because of the way the disorder is developed. According to the Mayo Clinic staff in 2017, the most common symptoms of DID include depression, anxiety, and suicidal thoughts and behaviors. Patients have also stated that they experience a loss of memories of people around them, events, and certain time periods. The feeling of a blurred sense of identity also occurs in most patients. This feeling relates to a sense of detachment that patients feel. Most patients who have the detachment symptom exclude themselves from people around them and from their own thoughts. When a DID patient detaches his or herself from their own mind, an alternate personality can develop. In a research conducted by Dr. Arthur Lieber, it was discovered that patients who suffer from DID are all similar because of experiencing the trauma that caused the disorder. Different or multiple personalities appear when a person wants to break away from their painful emotions. Personalities that have not suffered the trauma can emerge. An alternate personality can also emerge as someone who stopped progressing at the age the trauma was experienced. Patients do not always know when an alternate personality emerges. The patient experiences a sort of blackout period where they cannot remember where they are for long periods of time. People who suffer from DID develop alters as their disease progresses. Alters can be anyone or anything, including animals, young children, or people of the opposite sex. Most people with DID start with 2 or 3 alters as the disease is diagnosed, but progress into even hundreds. During childhood, an alternate personality can go undetected as a child is still developing and growing. The more dramatic symptoms of the disease include the suicidal thoughts and behaviors and the alternate personalities. Once an alternate personality is developed, the alter exists as a different person or thing, only looking like the original patient or the host. While the host may be unaware at the time of the switch, the alter is aware. As the original patient acknowledges that he or she is suffering from the disorder, they can realize the signs that a switch is about to happen or is happening. Because the alternate personalities are not always present, therapists sometimes only see the simple symptoms, and the host patient does not always accept that they have the disorder. When the therapist only sees these simple symptoms, these are the only symptoms that are treated, which sends a patient into a never-ending cycle of untreated emotions. And for some patients, the symptoms are just hard to relay to someone. Treatments for DID are very limited. DID symptoms cannot be treated as a whole, they can only be treated individually. The Mayo Clinic staff was able to discover that specific medications do not exist. However, most doctors and psychiatrists will prescribe individual drugs such as anti-anxiety, antipsychotic, and antidepressants. While medications can help the treatable symptoms, dissociative disorder's primary treatment is psychotherapy. Psychotherapy is a form of talk therapy where psychiatrists encourage patients to talk about their disorder. The most common trigger for DID is stress. Therapists will work with their patients to develop new ways to handle stressful situations and new coping methods. Once a connection between patient and therapist has been developed, the therapist will then try to get the patient to experience or to retell what happened to them as a child to make the disorder occur. As researchers and psychiatrists continue to study DID, they can uncover more treatment methods. So, is dissociative identity disorder genetic or caused by environmental factors? DID is caused by a patient who a patient is surrounded by and how a person is treated by his or her surroundings. Dr. Rumi Ogwan is a psychotherapist who specializes in DID, and he is quoted in a YouTube video stating, "The condition is the most primitive fundamental survival system which nearly always applies to overwhelming experiences for children growing up, usually from a very early age. Those situations where you are powerless when you're in extreme life-threatening situations, which the brain, in the sense, cannot deal." Dr. Ogwan's outlook on the disorder is accepted by many other psychotherapists in the world. The disorder is not one that can necessarily be stopped. When a child's mental identity has been compromised the first few times, there is no getting who that child once was back. DID patients do suffer from mental issues, but the host, the original patient, and even the alternate personalities are normal, very healthy people. Patients can live normal lives, hold steady jobs, and stable relationships, and can even learn to keep their alters under control. Doctors who are familiar with the DID are still looking for a better understanding about the disorder. DID is a complex disorder, as well as the causes and the symptoms. But as science and the understanding of the human brain evolves, will a cure for DID ever be found?